Hi, I'm Ahava Leaptag. Welcome back to What Did You Learn? I'm very excited to have here today Mary Ruland. Mary is the digital communication specialist for the Maryland Health Benefits Exchange, and she is going to give us a unique view inside of what's happening at state governments during the pandemic. Mary, welcome.
Thank you so much for having me.
Yeah, it's exciting. So before we sort of jump into all the good comm stuff and public health, tell me how you managed to while away the hours besides working during the quarantine and the pandemic.
I actually have a rescue Chihuahua. His name is Brisket. So he has kept me on my toes the past year of dealing with the craziness. I take lots of walks with him, and he's been like my work at home buddy. He's always next to me or not far. So he's definitely been a joy to have during this time, as well as me and my boyfriend actually bought our first home together in the beginning of the pandemic when it was just starting and everything was getting crazy. So it's been fun to do home projects and work along with him.
That's awesome. That sounds like a lot of fun. There's nothing else to do. So let's go through the honey to-do list, you know?
Yes, I was definitely one of the people that was at Lowe's and Home Depot a lot during the pandemic, trying to get things done.
Absolutely. I hear that. So describe to us a little bit about what the Maryland Health Benefits Exchange does. And then if you could walk us through like a typical day in your life during the pandemic, that would be awesome.
Sure. So the Maryland Health Benefit Exchange is actually Maryland's state marketplace. So we work hand in hand. We basically are the Affordable Care Act's marketplace for Maryland. So we help to get Marylanders covered and insured and make sure that, especially in times like this, that everyone is getting the health care that they need. In a typical day for me, I actually work a lot with our social media. I work to edit and manage our social media, as well as taking any consumer issues via our messages. I also am able to kind of go in and make sure that our messaging is working, especially as times change and different things are happening, to make sure that we're on track with, what's going on. And although there's been a lot of changes with COVID, there's also been a lot of changes with our agency, some in part to COVID and some just changes that are naturally happening.
Yeah, so I'm always fascinated by like information flow throughout an organization, and especially like take us back to those early days, like it's over a year ago now, when, like every 5 minutes, it seemed like a health directive was changing. Like you can do this, you can do that, don't do this, don't do that. How, A, did you keep on top of it? And B, how was it communicated and disseminated within the organization?
Sure. So the way, especially our marketing team was able to keep up with what was changing and what was going on was honestly just like many others, just making sure that we're doing the research and getting our information from proper resources, whether it was the Maryland Health Department, who is a partner of ours, or we're, researching with different things at the CDC, just making sure that we were keeping up with any topics that were changing.
But was there ever a moment where you were like, I really don't understand these guidelines. I'm going to get on the phone with somebody I know and try to sort this through?
Yes, and luckily with the agency, we had a lot of different departments in our agency were able to keep track of, certain things that were happening, especially with our policy department that was ever changing and what was being covered under the carriers that we had. We were making sure that internally we were all checked in and making sure that we were getting that information to people.
So when you say that you had to make sure that the communication messages were resonating with the people who you serve, right? The customers, How do you know that? How do you do that research? What data do you use to analyze that?
So in Maryland, we have some big cities, obviously like Baltimore, and we also have some rural communities. So just making sure that those messages applied for those different types of communities, and that we could take that complicated messaging of maybe what carriers were covering and maybe what they weren't, and turn that into something that the consumers could understand. And that messaging definitely was different for multiple areas in Maryland. So just to make sure that we were engaging with those and where they lived specifically, because that played a part into how we went about communicating.
Yeah, no, that makes a lot of sense. So when you're sitting down and you're thinking, so we know that literacy is challenging in this country, particularly numeracy, where, we're asking people to understand complex health subjects with numbers attached to them. And,
Right.
Even like I remember in the beginning when they talked about 6 feet apart, it was like, okay, that's a bicycle, like you have to give people a visual cue. So when you're thinking about, let's say, low literacy healthcare users, or even 9 out of 10 Americans struggle with health literacy, like it doesn't necessarily matter about your education level. It's just a complex web of things to navigate.
Yes.
When you're writing, are you using reading levels? Are you using plain language guidelines? Like, how are you making sure that these messages really do hit the people that you're trying to communicate with?
Yes, we work very heavily on health literacy and paying attention to what consumers, what messaging we could work with them. Basically, we do try to write on an 8th grade reading level. That is important to us because that is a baseline for what type of messaging we can get. And you're correct with, it doesn't matter what type of education someone has. There are a lot of complicated terms, especially in health insurance, that especially if you are coming from being off of, say, a parent's plan, for example. And, your parents, I know with me personally, my parents always helped me with my health insurance. I, didn't have to worry about it until
What's a premium? I remember when my mother said that to me, I was like, what's a premium? That's that kind of gas.
Right. And there's a lot of complicated terms, and even copay. There's a lot of people that don't know what a copay is. And I know that it's very overwhelming, and it can be a challenge to anybody, regardless of education level. So we just like to make sure that we simplify and we work through having those definitions available. On marylandhealthconnection.gov, we actually have a whole page that is a glossary for specific terms and just breaking down those definitions. On social media, we also do different posts, the word of the week, where we take a word and we help to explain it so people can understand it in simpler terms.
That's awesome. That's great. So Mary, when you're thinking about your audience, and you said, the younger audience is really a target for you, TikTok, Instagram stories, all that. Do you have a way to look at questions, or the questions you're getting most often, maybe through emails or the call center, and figuring out what to address? Is it more of a proactive thing? We need them to know about X, so we're just going to produce content around that topic. How do you make, that editorial mix decision?
Sure. So we rely on multiple things. Definitely different surveys that we put out to our consumers, as well as what content is really resonating with them. So we do quarterly reports internally, and we are assessing weekly what's working, what isn't working. For example, we actually work to do some advertisement during our open enrollment period last year, and we tapped into a tool called Twitch, which some people are familiar if they're in the gaming community, and it was definitely a wonderful thing that we did. We had a lot of reach for that, and we did some advertisement through Twitch, and it was a new area for us, but it worked really well. So just doing that extra research, we do have an outside agency that we work with that helps us and assists us with that to make sure that we are tapping into those audiences.
Yeah. So I was actually about to ask you that question because, it sounds like you're really given permission, sort of like a blessing from on high, to try new things, to try creative avenues. Where do you think that permission comes from? Because for a lot of our audience, they bring the exact same ideas to their executives, and their executives are like, no, we're not, that's not where our audience is, or that's not where we're going to spend our money. And so how do you sort of get that buy-in?
Sure. So I think it's basically just to have that data. I mean, data is so important, and we rely on it heavily. And we work again internally to make sure that the data is lining up with what we decide to message. For example, with vaccines, we definitely wanted to make sure that everything was in line for them before we started pushing specific go get your vax posts. And we still continue to message on testing and social distancing and mask wearing, because that obviously has been important for the last year. But in terms of actually getting the vaccine, just making sure we are lined up with that data.
The infodemic and the amount of misinformation that was out there. If I were you, and I'm just, assuming here, so it'd be really interesting to hear you answer the question, but I want to get this in there is, at some point you have to ask yourself, what am I able to influence and what am I able to control? At what point do we just say, like, there's a certain amount of stuff here that we're just not going to be able to sort of combat? Or has it always been this really sort of like, no, these are mistakes and problems and misunderstandings, and we constantly have to try to correct them? How did you work that balance out?
I would say for us, working out the balance of making sure that we were accurate and, fair was honestly a lot of rounds of editing. That was, that's a huge part for us, especially in marketing. We are always doing massive amounts of editing. And if there is a time where, say, on Tuesday, something's going to work and we think it's a plausible piece of information, by Thursday, it might not be. So I think that our motto for the past year has definitely been new day, new challenges. And that's been it, and I do love my position for that, is that we wake up every day, and especially a lot of people in marketing can resonate with that every day is something new. It's a new challenge. And that has definitely been put to the test since.
That is a great attitude. Exactly. New day, new challenge. I agree 100%. So what do you think, if I'm talking to Mary Ruland in, 3 years from now, and we're past all this, we're not wearing masks, the trauma has sort of faded a little bit into the background. And I say to you, what tool as a marketer did you put in your toolbox during the pandemic, or did you sharpen, that you really now look back over the last 3 years and you've used on a really regular basis? What do you think that tool would be?
I would say that I touched on this a little bit before, is branching out to those new areas of advertisement that we never thought about, as well as utilizing our local government leadership. We had a lot of press releases go out in the last year. We had a COVID-19 special enrollment period that has been going on since March of 2020, and it is still open for anybody who is uninsured. So for us, reaching to Governor Larry Hogan, he has helped us push our press releases as well as announce how many people we've had covered. And he has really made a difference in helping us just get that word out to Marylanders, and just utilizing those connections to make sure that, we're reaching everyone we can in different areas.
And I think that that's such a great attitude, because I think that a lot of healthcare marketers and communicators feel stymied. It's like they can't necessarily always get the budget or the permission that they need to try new things, to be brave. And here you're saying, listen, we went to our executives and we said, here's the data, give us a chance to do this. You told us to do this. And I think it's such a great story. It's such a good success story. So congratulations.
Thank you. We appreciate it. The agency itself we've all been working very hard the last year. And I would say definitely one of our biggest challenges, especially in marketing, but as an agency whole, is we are figuring out different ways to do that outreach, right? So we used to go to local community events around the state of Maryland, and we couldn't do that anymore. We couldn't be in person anymore. So we've had a couple virtual sessions where we have had our executive director, Michelle Eberly, and a couple different people in the healthcare sector come out and talk about vaccines, talk about coverage. So we're still getting that outreach to consumers, as well as just trying to tap into new things like digital advertisement. We used to we would do it a lot, but we wouldn't be heavily involved. But we can't get out there because during 2021, no one was supposed to be out of their house. So we had to definitely tap into different things. So another one we did was Hulu advertising, which was really important because so many people were watching TV and so many people.
There you go. It's necessity is the mother of invention. You just said it yourself, right? It's like, okay, this is what we were dealing with. And I also think it's that agility about your audience, right? Like, so your distribution strategy has to change because they're not outside their houses and they're not going to community meetings and they're not looking at billboards on the side of the road. You know, they're not going anywhere. So where do you reach them? That's fantastic. Well, Mary, thank you so much. How can people reach you if they have further questions? Which I think they will.
Yes, you can reach me. I can actually give you my email. It's mary.ruland@maryland.gov. And if anyone has any questions or is looking to get health coverage, you can look on our website at marylandhealthconnection.gov.
Awesome. Awesome. Thank you so much for being here. It was really great.
Thank you so much. I appreciate it.